Why is dementia diagnosis so variable across regions? Dementia diagnosis can look very different depending on where you are in the world. This variation is not just about how many people have dementia but also about how well it is recognized and diagnosed in different areas. Let's explore some key reasons why this happens. First, the intensity of diagnosis varies. In some regions, healthcare providers are more proactive in identifying dementia. This can depend on local healthcare policies, the availability of specialized memory services, and the training of primary care providers. In fact, areas with higher diagnostic intensity can see up to double the likelihood of dementia diagnosis compared to those with lower intensity, even when considering population risk factors. Next, population demographics play a significant role. Factors such as age, race, ethnicity, and socioeconomic status can affect how often dementia is diagnosed. For example, younger older adults and minoritized groups, like Black and Hispanic populations, often show greater variability in diagnosis rates. This indicates that there may be disparities in access to care or differences in how symptoms are recognized in these groups. Local socioeconomic conditions also impact diagnosis rates. Areas with higher poverty levels or those that are more rural may have fewer resources for dementia diagnosis. This can lead to less proactive case finding and more barriers to getting a diagnosis, resulting in lower recorded rates of dementia. The pathways from recognizing symptoms to receiving a diagnosis can differ widely by region. Variations in how primary care refers patients, the availability of memory clinics, and even how willing patients are to seek help can all influence diagnosis rates. Delays or inefficiencies in these pathways can contribute to the differences we see across regions. Healthcare system organization and policy also play a role. Some regions prioritize dementia diagnosis more than others, with targeted initiatives to increase diagnosis rates. In contrast, areas without such programs may struggle with uneven detection of dementia. Interestingly, research shows that these differences in diagnosis intensity do not simply reflect true differences in how many people have dementia. Instead, localized healthcare practices and system factors are major contributors. This means that neighboring regions can have very different diagnosis rates despite having similar population risks. Understanding these factors is crucial for improving dementia diagnosis, especially in underserved areas. Tailored efforts focusing on younger older adults and minoritized populations can help. Enhancing primary care capacity, streamlining referral processes, and addressing socioeconomic barriers are all important strategies to reduce these disparities. In summary, the variability in dementia diagnosis across regions is influenced by differences in healthcare practices, population demographics, socioeconomic factors, and diagnostic pathways. It is essential to address these issues to ensure that everyone experiencing memory loss receives timely and equitable care.